5 organizations whose daily operations involve helping people with health-related issues have received assistance from the Global Fund to continue the next phase of their work. The checks were handed out this time through the principal recipient of the funds, the National Health Insurance. General Manager of NHI, Dr. Roman Figueroa.
We basically signed the agreement to disburse the funds that are assigned to them to implement activities and plans that have already been approved for implementation for this first quarter. They have to report on every activity that they implement, and this is linked to the national plan, which is already an official and approved document.
The Belize Family Life Association, BFLA, offers HIV testing to people from all social backgrounds, as their general manager, Joan Burke-Skeen, told us.
We have what we call an essential package of services that we provide as an organization, and so that is one of those services is HIV testing. And so definitely what Global Fund does for us is to complement what we do as an association. Also, because we are sexual rights advocates, we ensure that our services, we do not discriminate. And so, having been the recipient for the fund area that deals specifically with key populations, this assists the association in meeting the key pops that we work with particularly.
The Global Fund's focal point in Belize, Ruth Jaramillo, spoke more about the program.
What this project has done is that it allowed, opened the conduit again for the hiring of key personnel, particularly under the Ministry of Health, as we mentioned before, with the employment of additional adherence counselor, a TB HIV coordinator, and some other key positions. The gene expert machines and all the required equipment have been procured already and distributed to the Ministry of Health. This is good news because that means that if you need to be monitored for viral load, it is now available in every district. So that makes accessing services easier for the client.
And this is where the Ministry of Health plays a key role, according to Dr. Melissa Diaz, who is the Director of Public Health and Wellness.
The Ministry of Health has worked closely with National AIDS Commission and as well with Global Funds before to target populations that are more difficult or populations who don't seem to access care the way that we want them to access care, including patients with HIV, tuberculosis, and other areas as well. So persons who might not feel comfortable coming into one of our health facilities or coming in through the regular route. We work with the C.S.O hubs and with other partners who are able to ensure that they're known as peer navigators. So the peer navigators will go out and try to recruit patients so that we ensure that we put that emphasis in preventative medicine and in primary care.
Jaramillo identified that one area of service that needs to be strengthened is advocacy. She said that they would be calling on the National AIDS Commission to assist with that effort. Reporting for News 5, I'm Marion Ali.